So my name's Chris Wild, and I'm the new director of the International Agency for Research on Cancer, and I took up the office at the beginning of January this year, 2009, and I was elected for a period of 5 years.
Okay, could you tell us a little bit about what you think are the links between cancer and the environment, please?
Well, clearly we've got very good evidence that the majority of cancers have got an environmental basis. But when I make that statement, obviously I'm defining the environment quite broadly, so that would include things like lifestyle factors, tobacco, infections, chronic infections, for example, as well as the more environmental contaminants side of how we think about the environment. So the good news is, with that strong environmental component in cancer causation, that there's a possibility to prevent, in principle, prevent the majority of cancers. If we think more specifically about sort of environmental chemicals and cancer risk, I think for me they fall into two broad categories. There's the naturally occurring chemicals, and here I refer to things such as aflatoxins or arsenic contaminating drinking water, which are strong evidence that they cause cancer in people. And then the chemicals that are more a consequence of human activity, things like air pollution, diesel exhausts, but also in developing countries things like the use of solid fuels for cooking and heating in the household. So these factors also have been linked to cancer in some studies in human populations.
Okay. And can you tell us a bit about how IARC is researching these links, especially with relation to the environmental chemicals, the non-lifestyle type factors?
Yes, I think the agency has quite a broad range of activities that are relevant in this respect. One of the major programs of the agency is the monographs program, the IARC monographs program. What we do here is assemble expert working groups to assess really all the evidence that in relation to a particular exposure and cancer risk, and try to evaluate that evidence. And so we deal with quite a lot of environmental chemicals in that respect, and we're currently actually going through a review of a number of those chemicals that previously have been classified as human carcinogens. So one aspect of our work is that evaluation and classification of carcinogens. Then we also ourselves conduct research into the causes of cancer. And so there are a number of projects that involve exposure to environmental chemicals and human cancer risk, where we try to bring a combination of epidemiology and laboratory science to bear on those questions. An example would be that the agency has participated in a big European network study on air pollution and cancer, and tried to generate new information on the sort of genetic changes induced in individuals exposed to higher levels of air pollution. And just more generally, certainly in my own interest, I think one of the things I would like to strengthen at the agency in my time there is the improvement in measurement of human exposure to these compounds. So we know that exposure exists, but often it's to quite complex mixtures of, let's say, with air pollution or with traffic exhausts and so on. And so it's very difficult to accurately quantitate individual exposure to those mixtures. And again, by bringing the laboratory science to bear on that, I hope that we will have better tools in the future to address the sorts of questions that you're interested in.
Okay, thank you. And can you talk a little bit more about some of the other gaps between the scientific knowledge and the proof that we already have about these links? And I'm thinking in particular how we can use some of our research expertise and capability towards beefing up public health preventative actions.
I think this is a very interesting question, actually. I think to do that, as a research institute, my view is that we need to provide the information on the magnitude of the risks associated with exposure. So in a sense, I would repeat one of the earlier comments, which is about the need to improve the measurement of exposure to these compounds. Also, though, some of the new technologies we have available in the agency to look at the biological effects of exposure. So can we demonstrate that in individuals who have those exposures, there's some biological consequence to that which is important for the cancer process. So trying to build up a little bit more the evidence to show that the exposure has some consequences on steps which we know are important in the development of cancer is very important. And then I think that leads into the need to be more quantitative in our estimates of risk in relation to exposure. And this is quite a challenging area, which those earlier aspects that I've just mentioned feed into that process. So there are a number of ways in which I think we can strengthen the evidence base to provide that information to the people who have to make the regulatory decisions.
Okay, thank you very much.